All right, let's get right into it. Today, we're tackling something absolutely fundamental in restorative dentistry. I'm talking about the blueprint, the master plan for a perfect amalgam preparation. And look, getting this right, it's not just about acing your exams. This is about creating restorations that are built to last a patient's entire life.
So let's start with the one question that really matters, right? What are the non-negotiable, can't mess this up rules for this procedure? What's the real difference between a restoration that's just good enough and one that is absolutely great? Stick with me, because by the end of this, you're going to have that answer down cold. So here's our game plan. We're going to start with the core principle that really guides everything. Then we'll jump into the two-stage process, cover the golden rules that you just can't ignore, give you a killer tip for those faculty checkpoints, and finally, wrap it all up to show how it all leads to longevity. Ready? Let's go.
First things first, the single most important idea in modern dentistry is this: be conservative by design. Seriously, the old school thinking of extension for prevention, that's ancient history. Today, the goal is to save every last bit of healthy, natural tooth structure that we possibly can. Okay, so this right here, this is a total game changer in how you should think about prep design. You know those perfect, idealized shapes you see in textbooks? Forget them. In the real world, the caries is your guide. The decay literally draws the map for you. You're not just carving a generic shape, you're letting the disease itself dictate the final outline. It's a huge shift in mindset.
And why do we care so much about this? Well, there are three massive reasons. Number one, it leaves the tooth as strong as it can possibly be. Number two, you maximize that crucial support from the dentin underneath. And number three, and your patients will thank you for this one, it directly cuts down on irritation to the pulp. The less dentin you have to remove, the happier that nerve is going to be. Simple as that.
Okay, so let's see how this all fits into a real workflow. Look, this can feel like a complex process. So to make it totally manageable, we break it down into a structured, two-stage approach. And this isn't just for exams, it's a system that makes sure you're methodical and you don't skip any crucial steps in the clinic.
The best way to think about it is like building a house. The initial stage, that's you laying the foundation and framing the walls. You're establishing the blueprint. You're creating that primary shape, getting the right depth, and putting in your main retention features. Then, the final stage is like finishing work. You're going in, cleaning up any last little problems, and adding the fine details, the secondary features that make it perfect. So, in that all-important initial stage, you have four main jobs. First, you extend your outline just until you hit healthy tooth on all sides. Second, you establish a nice, uniform depth all around the edges. Third, you create those initial undercuts for retention. And fourth, you make sure your walls are angled to create that perfect 90-degree margin for the amalgam. Get these four things right, and your foundation is solid.
So, once that blueprint is laid out, you switch gears to the final stage. Now it's about refinement. Your first job is to get rid of any leftover decay or pieces of an old filling. Then you start customizing. Does this specific tooth need a little extra grip? You can add some grooves or slots. Does it need to be stronger against fracture? You can refine the internal shape. This is where you tailor the prep for what that individual tooth actually needs.
Now, you might be wondering, why all these specific rules? Well, it's because amalgam isn't magic. It's a material with its own set of physical properties. It's an absolute beast under compression, but it has weaknesses we have to engineer around. So these aren't just suggestions. They're the golden rules for making it work.
And that brings us to golden rule number one. That number, 90 degrees, is everything. We're talking about the cavo-surface margin, basically where your prep meets the outside of the tooth. It has to be as close to 90 degrees as you can get it. Why? Well, amalgam is tough, but it's brittle at the edges. It has terrible edge strength. If you make that angle too sharp, you get a thin little fin of amalgam that's just going to chip and fracture the second the patient bites down. A solid 90-degree butt joint gives you a solid block of material right at the edge, which is exactly what you need for it to last.
Golden rule number 2 is all about depth. You absolutely need a minimum thickness of 1.5 to 2 millimeters of amalgam. If you go any thinner than that, the material can literally flex when the patient chews. And that constant flexing leads to fatigue and, you guessed it, a bulk fracture. That is by far the most common reason these restorations fail. That depth gives you the bulk you need for strength.
And finally, we got to talk about retention. You see, unlike composite, amalgam doesn't chemically bond or glue itself to the tooth. So how do we get it to stay put? Simple. We have to lock it in mechanically. And we do that by creating undercuts, which just means making the inside of the prep a tiny bit wider than the opening.
When the amalgam sets, it's physically locked in place. It literally can't come out. Okay, quick timeout for a super important practical tip. This one is for all of you in the preclinical labs, facing that moment of truth, the faculty checkpoint. This quote right here tells you exactly what's going on in your instructor's head. They need to see your process. They need to know that you understand the principles. If you just go in and remove all the decay at once, they have no idea if you hit the right depth because you followed the rules, or if you just got lucky by chasing a really deep cavity.
So here's the big takeaway, the pro tip for your lab sessions. You've got to stop at the right moment. Finish that entire initial stage, get your outline perfect, nail that uniform depth, create your basic retention, and then, and only then, do you call your instructor over. This way, they can actually see your work. They can see that you built the blueprint correctly before you go in and remove that last bit of decay. It proves you know the process.
All right, let's bring this all home. We've talked about the big principle, the stages, the rules, but how does it all come together to create a restoration that's still going to be there for your patient decades from now?
You know, when you look at it this way, it's actually pretty simple. Every single thing we talked about is a pillar holding up that longevity. Being conservative keeps the tooth strong, getting the form right, that 90-degree margin and proper depth respects what amalgam can and can't do, and that prevents it from fracturing. The mechanical undercuts keeps it from popping out, and following that two-stage process just makes sure you don't miss a thing. It's a complete system designed for success.
So I'll leave you with this to think about. We've just handed you the blueprint for successful amalgam prep. The principles are clear, the rules are non-negotiable. So the real challenge, the real art, is taking this blueprint and applying it with precision and with care every single time for every single patient you see.
And that's a wrap for this explainer. If you want to go even deeper and see more detailed techniques, make sure you follow the work of Dr. Sarang Suresh. He's got some fantastic insights. Thanks for tuning in.